Dr. Dennis, I have a few questions for you. So I need a filling. What exactly is a cavity and why did I get one?
Why did you get a cavity? Bacteria lives in our skin, on our skin, in our stomachs, all over us, and especially in our mouths. And what we eat is what the bacteria eats. So if you can imagine, and we have other illustrations to show how this works, if you can imagine if that bacteria is living in your mouth and you have something sugary or sweet to eat, they eat too. And when they eat, what their waste product is acid. And the acid will sit on top of your teeth and erode away your enamel. After it erodes away your enamel, it eventually will go into the next layer of your tooth, which is the dentin. And if untreated, will go down into the nerve. Now that's why you get cavities. And a lot of people ask me, well, I brush and floss my teeth all the time. I do all the things I'm supposed to do. I even go to the dentist on a regular basis, but I still sometimes get cavities. Now, your disposition to getting cavities is different for everyone. Some people, they don't do any of the right things and they don't get cavities, and some people do all of the right things and get cavities. You have to think about it. It's a part of your genetic makeup. Some people, they don't exercise and they stay thin. Some people eat whatever they want and they stay thin, and some people do everything and they're struggling with it all the time. Some people live very healthy lives and still get very bad diseases and illnesses. So even if you have the chip stacked against you genetically, you want to make sure you're doing everything you can to keep it away. So it's a natural course of events that the things that live in your mouth are going to deposit an acid onto your teeth to eat away at the enamel and form holes and black spots. Now, what you do about that is the most important part, and that's why it's so important to get your cavities filled as soon as we find them.
But I don't feel any pain. Are you sure I have a cavity?
One of the favorite things that I say in my office is pain is not a good indicator. And the reason I say pain is not a good indicator is if you're waiting for something to hurt, by the time it hurts, it's usually has gotten pretty bad. So a lot of times when I tell a person, oh, you have a cavity here, you have a cavity there, you need a filling here, you need a filling there, they say, but nothing hurts. And the reason they say nothing hurts is because that cavity is still at the top parts of the tooth, still in the enamel, just getting started. And as it moves deeper and deeper into the tooth, that is when sensations like sweet or hot or cold or sometimes bite will start to hurt. But I have seen on so many occasions someone with a large cavity and they have no sensation. Somebody with a completely blown out tooth and no sensation. So if we use pain simply as an indicator to say, oh, I don't have pain, I don't have any symptoms, it doesn't hurt when I have sweet, hot, cold bite, then it usually is going to be much more deeper, and usually something more like needing a root canal than just simply needing a filling. So that's why it's so important to see your dentist on a regular basis, because we will catch things before they become painful.
Do I have a choice between silver or white filling?
Yes, there are two types of fillings that there are. There are silver fillings, which some people call amalgam, mercury fillings. Sometimes they look black or dark after they've been there for a long time. And then there's white fillings, which are composite resin that are actually bonded to the tooth, which are a lot better to look at. In my office, personally, I do not place any silver fillings. I only do white fillings. And I do that for a couple of different reasons. Number one, most people don't want them. Nobody really wants to have something that is so obviously silver in their mouth that makes their tooth look darker gray. Number two, a white filling is actually bonded to the tooth and not mechanically placed within the tooth. So a lot less tooth structure needs to be taken away in order for that white filling to stay. Now, a lot of the old, I shouldn't say old school dentists, because there are still some dentists now placing silver fillings. But once upon a time, silver fillings were the thing that most dentists did. So I see a lot of patients who have silver fillings and they say, Dr. Dennis, should I have my silver fillings removed? And for the most part, if the silver filling has not broken down, If it is not open around the edges, I don't really see a need to replace it. Now, there are times where there's silver fillings that are very, very big. They kind of overrun the tooth. And most of the time, if you don't get that taken care of, when the tooth does break or a new cavity does form, you will need a crown. So in order to avoid that, sometimes we'll kind of preventatively take some of that old stuff out and put a new, nice porcelain, beautiful white crown on there, and then you don't have to risk losing the tooth altogether. Now, if you do have silver fillings that we decide together are worth replacing for cosmetic reasons, or there's a new cavity that's formed under that filling, what I normally do is we drill that all out and then we place a new white filling depending on the size of the existing cavity. Now, I wanted to make a special note about the whole debate about mercury fillings and the silver fillings and all of that. The reality is that unless the filling is breaking down, if it's open along the edges or we're actually taking it out or putting in, the mercury is not being released into your mouth. Now, those things are very microscopic. We can't always tell. I've had patients say that they have had all their silver fillings removed for health reasons, and that's definitely a personal choice that we can discuss when you come in. But for the most part, I say, you know, when things are breaking down, that's when stuff can come out. When we're removing it, that's where stuff can come out. And we take very careful precautions to make sure that we can capture as much of that as possible when we are removing your silver fillings.
Do I need to be numbed? Will it hurt?
One of the most popular questions I get no matter what is it going to hurt? And dentistry doesn't necessarily have a great reputation for making things painless. However, I will say this. In my practice, if I have caught a cavity at a very, very early stage, meaning it's very small, still in the enamel, I usually will decide at that point when I see you whether or not we can possibly even do the filling without anesthesia. That means no shots or needles. Now, that is my choice usually to make, and I'll say to you, listen, I think this is really small. Do you want to try doing this without getting numb? And I would say, at any point, if you don't like the way it feels, we will stop and get you numb, and that won't be necessary. But it's really nice when we catch a filling that is small, or a cavity that is small, that we can fill it without numbing, no shots or needles. You go home, no restrictions. You don't have to, you can eat anything you like, and there's nothing you can stop from doing for that day. Now, let's say we have a larger one. We have to numb you. And the reason that we're numbing you for anything in dentistry is to make you comfortable. We do not desire as dentists to have you in pain, contrary to popular belief. The reality is it's just as stressful for you as it is for us to have a patient in pain. So we want you to be comfortable. And if that means a quick shot to make you comfortable, that is what we're going to do. Most of the time, we feel about it for 5 seconds, you take nice deep breaths, and it's over. But it's worth that few seconds in order for you to be comfortable. But in my practice, I'm very sensitive. I tell my patients to raise their hand if they feel uncomfortable. And the reality is, all they have to do is make a face, and I'll say, hey, are you okay? So as long as we communicate, we will make sure that that visit is a pain-free one.
What if I don't get my fillings done? What can happen?
What happens if I don't do my fillings right away? Oh, goodness. I tell patients all the time, they'll say, Dr. Denis, I have a cavity. Can I wait a couple months? Can I wait a week? I have no idea how fast your cavities will grow. And all they do is grow. Cavities do not get smaller. They only get bigger. Now, for some people, depending on your diet and your genetics and a lot of different factors, cavities may grow at a slow rate. And I may see you in 6 months and it looks the same, but it's not gone. Or they will rapidly grow from something that is very benign to something big within a week or two or just very few days. Now, that is not something I can predict, but what I can predict, if those cavities stay untreated, if you do not get those cavities filled, eventually those cavities will slowly burrow into the inside of your tooth, eventually either causing the tooth to need a root canal and lots of pain along with it, or infection, abscess, or it will eventually be so bad that it will be completely destroyed. I see people all the time. I saw them 6 months ago. I told them they needed a filling and they didn't do it. Doesn't hurt right now. I don't know what she's talking about. And then they come back in 6 months and I see them on the schedule for a filling. And I always say to them, hey, what brings you back? Did that tooth start bothering you? And they say yes. And guess what? It's not a filling anymore. Now, if you're in that much pain, a filling is not going to take that kind of pain away. So now we have to reevaluate the situation, determine if there's something new that can be done. The same thing goes for root canals. If you don't do a root canal, it just gets so big that it completely destroys the tooth altogether until you have to have the tooth extracted. Of course, if that's a wisdom tooth, we're going to remove it anyways. But sometimes, most of the time, if you have a cavity between a tooth, it kind of shares the decay. So you'll see a cavity between a tooth and that tooth on this side and that tooth. So it just continues to grow. I like to make the analogy that cavities are like bad apples. If they go untreated, they kind of just eat away the whole bunch and it just keeps going and going and going. So it's only to your benefit and to your financial benefit to take care of a cavity while it's small. You'll save yourself tons of pain and tons of money.
How do I prevent myself from getting more fillings in the future?
Preventing cavities is a tricky question. The reason it's a tricky question because there's so many different factors that come into preventing cavities. For the most part, if you're brushing twice a day for 2 minutes a day, you're flossing, those are the basics. That's what you want to do. You want to keep that bacteria from having lots of food to eat between meals. So if you've eaten something or drank something really sugary, maybe you should rinse your mouth with a little water or brush your teeth if you have access to it at that time if you're not at home. But for the most part, you want to have good hygiene. But good hygiene is a two-part thing. Good hygiene means brushing and flossing at home, but good hygiene also means going to the dentist on a regular basis and having your teeth cleaned, having your teeth checked, because there's only so much that you can do at home. I see people all the time, they have lots of big chunks of calculus or plaque on their teeth and they say, well, I brush and floss all the time and it won't come off. And that's because if you could do it all alone at home, then you wouldn't need us. You wouldn't need a hygienist, you wouldn't need a dentist to help you keep your teeth. So you do your part at home, we do our part. And a lot of our part is helping to prevent. We use fluoride varnish sometimes for people who are high cavity risk, and we'll give you tips of things that you need to do at home for your particular situation. But for the most part, what I do as a dentist is catch things early. If I can catch things early, I can help you avoid a lot of more expensive, more painful treatments that are very unnecessary if you get those smaller things done. Yes, dentistry is not comfortable, but there are so many things that I can show you and so many things I can do for you to keep that very minimalistic. So most of the times I'm saying, hey, how you doing? And saying, hey, you're doing a good job, have a great day. And that's really the kind of visit that I aim to get to most of my patients. So, a lot of times when I meet somebody for the first time, we got lots to do because we just met and maybe you haven't seen a dentist in a while. But once we get you nice and healthy, my focus for you is prevention. I want you to get better unless some unforeseen accident happens. For the most part, we want to keep you to just maintenance visits. We see you on a regular basis, we make sure you're okay, and that's pretty much it. So prevention is two-part. You do your part at home and we help you in our office.
Thank you, Dr. Denis.